everybody, welcome back to Practically Pediatrics. I'm Dr. Marianne Iskander. Today we're talking about sleep, which is so important for your baby and for you. Remember, sleep. Yeah, those were good times. Let's talk baby sleep. So newborns typically need 16 to 20 hours of sleep in a 24-hour period. So don't worry if your newborn comes home and is sleeping most of the day and even most of the night sometimes. That is totally normal as long as they are waking up to feed enough and for a quick diaper change. They might have very short periods of wakefulness, about 30 minutes, an hour before they fall back asleep. Totally normal. Of course, we want newborns and infants to sleep on their back, facing up in a crib or bassinet. We want to take away all fluffy bedding, no pillows, no stuffed animals, no loose blankets. A good swaddle type blanket is okay, but no loose bedding that can possibly fall over the face of the baby, or nothing plush that they can accidentally turn their head into, because that is a risk of suffocation. Also, putting your baby to sleep on their stomach is a risk of SIDS, or sudden infant death syndrome. So always put your baby in a safe sleep space. Try not to co-sleep. I know there are advocates for co-sleeping. In the American Academy of Pediatrics, we do not recommend co-sleeping. Again, we consider it an increased risk of suffocation and SIDS. You might notice something funny about the way your baby breathes while your newborn is sleeping. They might have periods of panting and then breath holding and then going back into a normal breathing routine. That is really nothing to worry about. That is very typical in the first 3, sometimes even 4 months of life. We call it periodic breathing. And basically it's kind of like what I just described. It's a very irregular breathing pattern, and it just has to do with the breathing system in their brain not fully developed yet. So typically nothing to worry about as long as they are not breathing abnormally. And there's color change in the face, as long as their lips aren't turning blue or purple while they're doing that. Nothing to worry about there. After the first few months of life, your infant will be more in a predictable sleep routine. The total hours of sleep in a 24-hour period should total up to 13 to 15 hours. So that includes overnight and naps. Even if your infant is waking up at night, you don't typically have to feed them. You can try to rock them or soothe them back to sleep. It's a way to lightly sleep train them. You don't have to, but just know that they're not going to starve and they can go the whole night without feeding. That means during the day, you might have really big feeds, more than usual. In the infant period, we also want you to get used to putting your baby down sleepy but not fully asleep yet. We want to encourage independent sleeping, so putting themselves to sleep. So at this point, you should, like I said, be able to predict when your child is going to go down for a nap. Put them down with their eyes just barely closing. It's okay to let them fuss for a few minutes. Up to 10 minutes is usually okay. You can check on them periodically, but at this point, we do want them to be able to put themselves to sleep. Up until about 12 months, your child will be napping at least 3 times a day. So by the time you hit the toddler phase, around 18 months to 2 years old, your child will typically need 1 big nap in the middle of the day. Don't let your toddler nap past 4 o'clock. This is also the time to really encourage a routine sleep schedule. And that means you want to put your child down at the same time every single night. In our house, it is 8 o'clock. So leading up to 8 o'clock, you want to establish a sleep routine. So that means doing the same thing at the same time in the same way every single night. So for example, we eat dinner at 6 o'clock. By 6:30, 7 o'clock, it is kind of free time, playtime. By 7:30, we're going upstairs. We read a couple books, and then by 8 o'clock, good night, love you, lights out, and they will put themselves to sleep and we'll see them in the morning. So I really encourage that. The earlier you do this, the easier it is. Children's brains are made to adapt, but you have to reinforce, like I said, the same routine at the same time every single night, and it should be pretty smooth. After about a month or so, your child will be able to anticipate this is sleep time. The brain naturally will start to get sleepy around this time. And putting your child to sleep independently should be a little easier. Your toddler and young child will typically need a nap up until about 4 years of age. There is about half of the kids that still need a nap by about 3.5. 4 years of age, some kids still need a nap or want a nap, but most kids by the age of 4 years old do not need a nap. It is a sad day when your children don't want that mid nap, because we all know a nap for baby is a break for parents. So it's a little bit of a transition for both of you. Good luck planning activities for a whole day. By 15, 18 months max, somewhere in there, we want to take away bottles and pacifiers so that we don't keep reinforcing what we call sleep associations. A sleep association is something that your toddler psychologically needs to fall asleep. Like, I need the pacifier to fall asleep. I need to fall asleep with a bottle of milk in my mouth. So we don't want that. That is, for number one, the psychology of sleeping independently without the need of any aids, and also for dental health. So, you know, pacifier use and bottle use after a certain period will start to affect your teeth and gums and oral health. So we don't want that to happen. Let's talk sleep issues. So the number one thing I ask about is, does your child snore at night? Snoring is something we take very seriously for your kids' overall health. It has a general impact on a lot of systems in the body, more than you would think. And when I say snoring, I don't mean like heavily deep breathing. I mean snoring, like this really turbulent flow of air with almost every breath that lasts throughout the whole entire night. That is snoring. So if we think about snoring, the reason why snoring is so noisy and loud is because you are obstructing your airway, right? So you're either obstructing because of maybe adenoids are overgrown. Adenoids are tissue that sits in the back of the nose. Maybe tonsils are enlarged. Sometimes it just runs in the family, but it means your airway is obstructed. So let's think about that. If your child's airway is obstructed and they are sleeping 11, 12 hours straight, that is up to 12 hours of decreased oxygenation to your blood. So of course, that is not homeostasis. So there's going to be negative impacts from that. And also, if you think about it, your child will usually have very restless sleep if they are a snorer. And that's because if your brain senses the oxygen is low in the body, it's going to keep waking you up, because your brain is like, you're suffocating, we're not breathing properly. So it keeps waking your child up. They flip, they flop, they're up, they're down, they're on this side of the bed, that side of the bed, which could lead to daytime sleepiness. And some kids, it may lead to daytime hyperactivity because of lack of sleep. Your child is just wired. It could also lead to poor focus and learning issues in school, aggressive behavior, and on and on and on and on. The other system that might be impacted is actually the heart. So what happens is the obstruction is causing such a low dip in oxygen throughout the night. Your heart is going to sense low oxygenation, and it is going to have to pump faster and harder than usual to make up for the lack of oxygenation in the body. And over time, that can lead to heart enlargement and other issues in that area. So if your child snores loudly, consistently every night, they are having restless sleep, you need to talk to your doctor about that. What we usually do is send them to the ear, nose, and throat specialist. They will check the adenoids and tonsils, and your child might need what's called a sleep study to assess how good the quality of sleep they're getting is, how low their oxygen is dropping, are they holding their breath, are they going apneic, meaning are there periods where they are not breathing at all. If that is the case, your child might need their tonsils and adenoids removed. And for the children that do need that, there is an immediate improvement of sleep and an improvement of behavior during the day. Generally, happier, healthier children. The other issue that can happen with sleep are night terrors. This is very distressing for parents. Usually it will run in the family. A night terror is when your child suddenly bolts up in bed, is screaming, flailing, sometimes being aggressive to their body, sometimes they're swinging at parents, getting up, running through the house. Their eyes are open, so it looks like they are awake, however, they're not really there. They're not really awake. They're talking gibberish, they're seeing things, they're grabbing at things. This is different than a nightmare. A nightmare is a scary dream that will wake up your child. Your child will be fully awake, remember the dream, and then be able to be put back to sleep. With a night terror, they are not awake. They are still in a dream state. So there is no use trying to wake them up. Actually, we don't recommend trying to wake them up. That can make the night terror last a lot longer and make them even more disoriented because they're kind of in this mid-lucid dreaming state. So don't try to wake your child up. If your child is trying to get out of bed or, harming themselves or harming you, just gently put your arms around them, keep them physically safe, try to talk to them in a very soothing voice, and eventually the night terror should pass. If your child is having night terrors most nights of the week, there is a technique you can try to prevent them from having the night terror. So number one is the obvious stuff. Decrease sugar intake before bed, decrease overstimulation before bedtime. So like the crazy video games and the cartoons, the sleep routine should be calm and quiet before bedtime. So that's number one. Number two is you might find that the sleep terror is happening within 2 hours after they're falling asleep. So you can kind of predict when it's going to happen after a certain point. So you might want to try to wake them up about 30-45 minutes before you predict the sleep terror happening. And what that does is that might reset their sleep cycle, because the night terrors will happen at a very specific stage of sleep. So if you wake them up before they hit stage 3-4, it will kind of reset the sleep cycle, and they might kind of skip over the time of the night terror and the sleep cycle that the night terror is going to happen in. That might help over time. Okay, I hope that helps. I will see you soon. Thank you.